How does HPV affect cervical cancer stages? Imagine a tiny virus that can quietly change the course of your health. Human papillomavirus, especially the high-risk types like HPV 16 and 18, is the main cause of cervical cancer. When HPV infects the cells of the cervix, it can trigger a series of changes that may lead to cancer if not caught early. The process begins when the virus infects the surface cells of the cervix, often causing mild abnormalities known as low-grade lesions or cervical intraepithelial neoplasia grade 1. These early changes are usually linked to temporary HPV infections that often clear up on their own without treatment. However, if the infection persists over time, especially with high-risk HPV types, it can cause more serious cellular abnormalities called cervical intraepithelial neoplasia grade 2 or 3, which are considered high-grade lesions. These are precancerous stages that carry a higher risk of progressing to invasive cancer. The virus disrupts normal cell functions by integrating its DNA into the host cell's genetic material. This integration interferes with the regulation of cell growth and division, leading to genetic mutations. A key part of this process involves the viral genes E6 and E7, which become overactive after integration. These genes inactivate tumor suppressor proteins like p53 and Rb, which normally help control cell growth and prevent cancer. When these proteins are turned off, cells can grow out of control, accumulate more genetic damage, and become cancerous. As the infection persists and the genetic damage accumulates, the disease can advance from high-grade precancerous lesions to invasive cervical cancer. Research shows that the more advanced the cervical cancer stage, the more likely it is that HPV DNA has integrated into the host genome. This integration is associated with increased genetic instability and more aggressive tumor behavior. It also influences how the cancer responds to treatment. Understanding how HPV affects each stage of cervical cancer highlights the importance of regular screening and vaccination. Screening tests can detect early changes before they develop into cancer, and vaccines protect against the high-risk HPV types that cause most cases. Early detection and vaccination are powerful tools in preventing the progression from HPV infection to invasive cancer. If you have concerns or questions about HPV or cervical health, it's always best to consult a healthcare professional for personalized advice and care.